எல்லாருக்கும் வணக்கம். இன்னொரு நேர்காணலோட உங்களெல்லாம் நான் சந்திக்கிறேன். ஒரு நல்ல மனிதன் இந்த நேர்காணலுக்கு வந்து சம்மந்திச்சு நேரத்தை ஒதுக்கி அவரோட அவரோட கஷ்டமான நேரத்தை வந்து நம்மளோட ஷேர் பண்றாரு. இன்னைக்கு அவரோட அப்பாவும் அம்மாவும் இழந்துட்டு நிக்கிறாரு COVID-19னால. சோ இந்த நேர்காணலை கண்டிப்பாக நீங்க பார்க்கணும். ஒரு 25-30 நிமிடங்கள் நீளமான ஒரு நேர்காணல். இப்ப உங்களுக்கு பார்க்க முடியாட்டி சேவ் பண்ணிக்கோங்க. ஃப்ரீயா இருக்கிறப்ப கண்டிப்பா பாருங்க. இந்த நேர்காணல் முடிஞ்ச பிறகு நான் உங்களை எல்லாம் திருப்பி சந்திக்கிறேன்.
Okay, good afternoon, bro. Thank you for doing this interview with me. It's actually very important what you're going to be sharing with us today. So my very first question, bro, you can start by sharing a little bit about yourself and about what happened with you and your family in regards to COVID-19 in Malaysia. Over to you, bro.
I think I'm just going to start directly with what happened.
Sure.
It all happened in June. In 1 month, I lost both my parents. And then it actually started with my father going into a vaccine center to get vaccinated.
Mm-hmm.
And my brother brought him there. And he contracted COVID from the vaccine center.
Mm-hmm.
We are pretty sure about it because he hardly goes out since the pandemic started, and my mom is bedridden, so she also doesn't go out. And we are also pretty sure he got it from there because my brother at the same time also tested positive.
Okay.
And this happened on let me look at my diary. It happened on the Monday, on the 31st of May. And
Okay.
then on Friday, my father got down with fever. And by Sunday, my brother decided to bring him to go tested. And my brother also tested himself at the same time. And they were both tested positive. And then on Sunday, I was there with, maybe I should tell a little bit more where we live.
Yeah. Sure.
So my parents live with my brother in Sri Kemangan.
Okay.
And we live separately, but I travel to see my mom every day. Okay, so on Sunday, when my father and my brother was tested positive, I decided to bring my mom over to my place to like separate them. And then by Wednesday night, my mother's temperature went up. And that is when the whole thing started, really.
Right.
And my father went into the hospital on Friday, 11th of June, and he passed away the next day on the 12th.
Very sorry, bro, to know this. I'm actually it's very heartbreaking. So you guys definitely couldn't see him, right? Did you get to see him one last time? No.
Yeah, we didn't get to see him. He was cremated immediately the next day, Sunday.
I see. Okay, bro.
Yeah, no chance to say goodbye.
Yeah, I know. I am so sorry, bro, seriously. But, your sharing is actually very important because, go on, bro, go on.
On the same day when he died, my mother went in to the hospital. And because my mom is bedridden and she has her conditions means that her speech is really blurry, so she can't move, she can't say anything. Basically, she's just a soul whose mind was clear but stuck in trapped in her own body.
Understand.
So
it's okay, bro. Take your time. It's okay. It's I know it's very hard. I'm so sorry, bro. I'm here for you. Don't worry, bro. Take your time, bro.
So on Saturday, when I brought her into the hospital, the hospital staff just said to me, "Oh, bring her down from the car and into the wheelchair, and then you go and register, and then that's it." And then when I went back after I registered, I never saw her again. She was just pushed in. And then I started to have all this bad thoughts that, she may never come out.
Yeah.
And anyway, so Saturday was day 4 for her.
Yeah.
So they talk about number of days for her COVID. So her symptoms started on Wednesday. So Saturday was day 4, even though Saturday was the first day she was hospitalized. And okay, so I was just harping on the idea that, after 10 days, she will be out. And so that means like another 6 or 7 days hospitalization for her. So I kept, yeah, we just kept hoping, she would come out after 10 days or so, So for her, it's just about tahan.
Yes.
You have to bite it through the 7 days. And I was very worried because I know she can't move, she can't speak. So, but anyway, the hospital system was quite good. So whenever you call the main line, there is always people to pick up the call.
Okay.
And when they connect you to the ward, there's always someone there to pick up the calls. But video calling the patients is quite difficult because it mostly depends on how free the nurse is, whether there's free time. So you can't really choose a time. So you might be calling there and then they might be picking up the phone, but then she's asleep or something. But anyway, after 10 days of her symptoms started, that means after about 7 days, 7 or 6 days hospitalization. So we were toying with the idea that to get her out because her vitals were still good, and then she could breathe on room air. She didn't need oxygen support. And then also by the 7 and 8 days, her fever and coughing already stopped. So with all these signs, to me, it sounds like her case was really mild.
Yeah, exactly. Seemed like that.
She didn't need incubator or something. Okay, but then when we were talking about her getting out, the hospital came up with acute kidney damage.
Acute kidney damage.
Meaning she was dehydrated, and the kidney damage doesn't sound so serious as the words make it sound like. It is actually reversible.
Yeah.
So they hydrated her again, then she was fine. But then this is actually quite unacceptable because she was on drip. There's no reason why she was dehydrated, right?
Exactly. Yeah. Understand. Yeah.
Yes. So anyway, the hospital didn't allow her to go back. It went on, and then we were like calling, and then the hospital said at some point, oh, her infectious biomarker has gone up. Yes, they said because her infectious marker went up, so she became infectious again. So if she had been let out of the hospital, she could be a threat to the public health. So I just called and argued with the hospital, and then And then at some point they also said, oh, her white blood cells count went up, so we can't let her out. And then they also said, oh, after a CT scan, they discovered white spots on her lungs. And then I was like, no, and then the next day they changed. Okay, it's not white spot, but it's a classical post-COVID lungs conditions. Like, you know, the lungs have become less elastic because of the infection. You have lost some tissues and some scarring there. And then they can't let her go back. It was like one after another. And then even when we used AOR, AOR means at our own risk. So to discharge her AOR, the hospital also like couldn't accept it. And then until we really fought, we just called. And especially when you have gone through a mild case, like my mother did, after 10 days, you are no longer infectious.
Yes, that is the,
But the hospital couldn't release her. It's like, why?
Yeah.
And now when I think back, all the they call the white spots in the lungs, and then that she needed some oxygen supplement supply again. Now and then she was alternating between room air and oxygen supply. These kind of things were all post-COVID symptoms, post-COVID complications. I even mentioned to the doctors that I'm worried about her emotional well-being, because emotional stress also plays a role in your immune system so much.
Yes, it does.
To the extent we don't realize it. And Western medicines only try to treat symptoms. That is a problem. They don't try to treat you as a human being. Like,
very true. Very true. Yes, you are right. Nobody looks into their mental well-being. Everybody is just so busy with the COVID and they don't really know.
And the symptoms.
Yes, the symptoms. Yes. Yeah, very true.
And the symptoms which they need test after test, poking a lot. Because when my mother came back, I just saw her body was totally wrecked, bruises everywhere, dry blood everywhere. It was just like, it was to the extent that even when I was checking the oxygen level, you know, the oxygen meter, I put a finger, she was even rejecting it, like she was a kind of paranoia to her.
Yeah. It's just.
And then when my mother passed away on the 29th, that was a Tuesday, we had to wait until Saturday to collect her body from the forensic, because she was queuing up to be tested whether she was still positive.
Obviously, she's going to show positive. I don't get it at all.
Oh, obviously, yes. I don't understand.
I mean, she was not a person who was brought in dead. She was literally in the hospital for a long time. They have a report. So there's no need to test her. Obviously, she's going to test positive because it hasn't been
obviously
6 months. Yeah.
Okay, we didn't plan a funeral service for our parents because we know that people wouldn't come anyway. So we just had simple prayers, and we put the ashes in nirvana, in a place. So it's not like we were waiting for the body for a funeral.
I get you. I feel you, bro. I seriously feel you. The system, I mean, there's so many complications in the system, you know, and different hospitals, they do things differently, and it's just not the same. It's not standardized, to tell you, you know.
I just want to say that when your family members are hospitalized because of COVID, you must, after around 10 or 14 days, you must ask yourself, is there a need to be hospitalized? Is there a need to continue to be hospitalized?
Yes, yes, correct. You're right. Because if they are not, if they're no longer impacted with the symptoms and making them severe, they are okay to go home
Yes,
and self-quarantine because they're okay already, you know. But
yes,
forcing them because, and also they don't have enough places for those who are serious now. So those who are okay, you should allow them because you are still monitoring them. Unless they're
yes.
living in, very confined spaces, then you can find some way. But if they have family support like you, for your mom, then they can easily let her go because they know that you're going to make sure that she's okay and self-isolating herself. So you see, you're right.
Because there's no consideration when she was OKU. There's no consideration for her mental health, for her
Mm,
emotional health at all.
yes.
It's just, and then she was on feeding tube.
Mm,
All the hospital only gave her ensure milk.
mm,
She was already very skinny before she went in. She
mm,
lost even more weight after.
mm. I mean, we understand that they are overwhelmed, but it's also their duty for people like us. I agree with you. We agree the situation in Malaysia is uncontrollable now and things have been haywire, big fiasco. But still, who do we go to, right? I mean, that's what you're trying to tell us. Who do we go to if not to them? It's this is something that we have to tell everyone. We don't need them to show their frustrations to us because it's us, facing the loss of our family member. And in your case, you have already lost your dad at that moment. So how else will you be handling this, right? Because now it's your mom. You have lost your dad, and now you're trying to, save your mom or do something. So this sharing is important, bro. It's just that what we need is the support that we need from them, because we can't go to anybody else, right? Because you are actually being the voice of many others who are going through what you've gone through, bro. Many people are unable to share their sadness and the frustration that happened in their life. A lot of them lost their spouses, a lot of them lost their wives, with baby in the stomach, and some of the babies died. Some of them have to cut open the stomach to take the baby, and then the thing is just that different family member in the family. Brought up a very important point here in regards to mental well-being. It's the mental well-being of the patients themselves is very much ignored. Like, that is very important, bro. I am very thankful for that message because you brought it up when you said the your mom was in that particular situation, was not well herself. She's bedridden, and nobody cared. That caring is important. How is she? It's not the disease anymore. So this is why I'm fighting so hard, because nobody really talks about mental well-being of the survivors, of the family members who have lost their loved ones. Nobody really gives importance to that. The COVID will go away, but this will stay. How are you going to go on living? This is important, bro. We have to open up people's eyes to see people beyond COVID, patients or family members.
Yes, because I already have guilt feelings like if we had gotten our mother out earlier, would she have survived?
Yeah, bro. I agree. Yeah.
So you have to stay informed. You have to search out for the terms, for the knowledge, for what it
Correct.
is. I was not informed about COVID because I just thought it will never hit me, as
Yes,
long as I
yes.
stay safe.
Very true, bro. Very
So I
true.
never really paid much attention to the COVID, what to expect in 5 days, or you quarantine 10 days, 14, what is the reason for 21 days? That
Correct.
sort of things. Yeah.
Very true, very true. What you have to tell our people out there who are in similar situations, not only for me, but also for everyone else who are, in similar situations like you, or who have also lost their loved ones. Anything, bro, anything that comes out from you will be very impactful for every one of us, bro. Just go all out, bro. Anything you want to share. Take your
I would
time.
say just treat them well, because you never know what happens in the next day.
Yeah, bro. That's actually very true. Life
So
is,
you don't want any regrets.
Yeah, bro, that's very true actually. It's so true. Yeah, that's very important message, bro. Very
So
important.
if you have family members, parents, or your siblings, which you have not seen for a long time because of the lockdown, call them, video call them. It's very important to stay in touch.
Yeah, we have to depend only on ourselves and our loved ones and our family, and also people we don't know. We can still help with awareness, and we can be the voice for others and tell other people, you know, whatever we can do is for all. So that means as a community, we have to stay strong, help each other, you know, it makes a difference, you know. So
And always question the authority, the doctors, the nurses.
அனைவருக்கும் மீண்டும் வணக்கம். அவருக்கு நான் திருப்பியும் பெரிய நன்றி தான் சொல்லணும். அவர் இந்த கஷ்டம்லாம் இருந்து கூட அவர் நேரத்தை ஒதுக்கி அவரோட மன கஷ்டங்களை நம்ம கிட்ட ஷேர் பண்ணியிருக்காரு. ரொம்ப கஷ்டமா இருந்தது. ஆனா ரொம்ப முக்கியமான ஒரு நேர்காணல் இது. அவர் எல்லாத்துக்குமே பேசியிருக்காரு. அவர் வந்து ஒரு குரலா இருந்திருக்கிறாரு. எல்லாரும் நம்ம நண்பர்கள் வெளியே வந்து அவங்க அப்பா அம்மா, அவங்க கூட பிறந்தவங்க, அவங்க கல்யாணம் பண்ணவங்க, அவங்க குழந்தைகள், அவங்க நேசிக்கிறவங்க நிறைய பேர் பறி கொடுத்துட்டு ரொம்ப கஷ்டப்படுறாங்க. அவர் ஒரு குரலா எல்லாத்துக்காகவும் பேசியிருக்காரு. இந்த COVID-19 நம்ம எடுத்துக்கிட்டோம்னா நம்ம உடலுக்கு மட்டும் பாதிப்பு கொடுக்கலங்க, நம்ம மன ஆரோக்கியத்துக்கும் ரொம்ப பாதிப்பு உண்டாகுது. நம்மளுக்கு மட்டும் இல்ல, அந்த நோய் வந்தவங்களுக்கு மட்டும் இல்ல, எல்லாத்துக்குமே நம்ம மன ஆரோக்கியத்தை பாதிச்சிருச்சுன்னா இந்த நோயோட நம்ம எப்படி போராடுறது? ஆனா இந்த காலகட்டத்துல இந்த டைம்ல நம்ம மன ஆரோக்கியத்துக்கும் நம்ம மன கஷ்டங்களுக்கும் யாரும் பெருசா எடுத்துக்கல. ஏன்னா உடலுக்கு என்ன ஆபத்து வருது, என்ன செய்யணும் அப்படிதான் பாக்குறாங்க. ஆனா நிறைய பேருக்கு வந்து அந்த மனஸ்தாபங்கள் உண்டாகுது, மன உடைச்சல் உண்டாகுது. அதெல்லாம் யாரும் பெருசா எடுத்துக்கல. சோ அதுதான் அவரும் எடுத்து சொல்லியிருக்காரு அவரோட அனுபவம் மூலியமா. இன்னொன்னுங்க, நம்ம நேசிக்கிறவங்களை இழக்கிறது வந்து நம்ம படத்துல பாக்குற மாதிரி இல்ல. கண்டிப்பாக நம்ம படத்துல பாக்குறது வந்து நம்ம உண்மையான நடக்கிற சம்பவத்தை தான், நம்ம லைஃப்ல நம்ம வாழ்க்கையில நடக்கிறத தான் படத்துல காட்டுறாங்க. ஆனா உண்மையான அனுபவம் வந்து யாராலுமே அது எவ்வளவு கஷ்டம்னு சொல்ல முடியாது. சோ நான் அந்த ஆர்டிக்கல் பத்தி முதல்ல பேசினேன். அது போன மாதத்துல நான் வந்து இறந்து போனவங்களுக்கும் அவங்க நேசிக்கிறவங்களுக்கும் நான் எழுதின ஒரு ட்ரிபியூட், ஒரு ஆர்டிக்கல் நான் எழுதினேன். அது கண்டிப்பா நான் பிளாட்ஃபார்ம்ல ஷேர் பண்றேன் எல்லாத்துக்கும். இந்த நேர்காணலோட இறுதி கட்டத்துக்கு நம்ம வந்துட்டோம். அதுக்கு முன்னால அவர் வந்து ஒரு சின்ன இசை, யூ லிஃப்ட் மீ அப், அதோட தலைப்பு சின்னதா வாசிச்சிருக்காரு. அவரோட அன்பான அப்பா அம்மாவுக்கும் COVID-19ல உயிர் இழந்த எல்லாத்துக்குமே அவரு இதை வாசிச்சிருக்காரு. நான் உங்களெல்லாம் திருப்பியும் சந்திப்பேன். அது வரைக்கும் உங்களை நீங்க நேசிக்கணும். அனைவரையும் நேசிங்க. ஒன்றாக உரிமையாக நிற்போம். அது வரைக்கும் டேக் கேர். பை பை.